Oh, more Americans than ever are turning to cosmetic injectables like Botox and fillers to try to look younger, maybe get rid of some wrinkles. But a new investigation reveals a dangerous rise in counterfeit versions being used in med spas nationwide. These fakes can cause some serious health risks. And joining us to talk about it is Dr. Oma Abai with UC Davis Health to talk about the dangers and risks. And what kind of risks are we seeing, Dr. Abai, from getting a fake injectable?
Yeah, so this is not just about a botched cosmetic procedure. This is a real public health risk, and fake Botox is being used in different scenarios in med spas, and it's inducing different possible adverse effects, specifically a condition called iatrogenic botulinum, or botulism.
Yeah.
And so what that is it's a syndrome where you can develop systemic effects to botulinum toxin, and that would induce trouble breathing. Sometimes it could even be blurry vision, could be difficulty speaking, it could be trouble swallowing.
Oh, wow.
And so the CDC and the FDA performed an investigation that showed 17 cases across 9 states of individuals who developed this syndrome. And of those 17, 13 were hospitalized. And this was all due to fake Botox.
Wow, that's pretty scary. So how would you go into your med spa, you go into wherever you normally get your injectables, how do you know and how can you be sure that what they say they're giving you and what you're paying for is actually what it is? It's actually real.
It's not easy, so that's the thing. The fake Botox looks very, very realistic, to the point where even dermatologists, board-certified dermatologists, sometimes are fooled. And so what are you looking for? You want to look for a specific word, and that word is onabotulinum toxin A. And so if you're not a medical professional, you might not remember that.
Right,
like exactly. So how do you know? And there are all these different clues, like the hologram and there are certain things like the lot number, the expiration date. So there are all these little clues, but how do you do that when you're at a med spa and you're trying to figure out what to do? So if there's one thing that you do, once you get there, ask to take a photo of the vial and the packaging. There's a little box that the vial comes in. So ask to take a photo. Just say, oh, do you mind for my own records if I just take a photo of these things? And you watch for the reaction. If there's any hesitation or the individual refuses to give that to you or allow you to take a photo, then that's a red flag.
So do you think that the people administering these fillers or injectables know that they're injecting a fake thing, or do you think they're being scammed as well?
Both are happening. So some individuals, some providers, they want to get a good deal, right? So they have all of these different companies that are unauthorized distributors who are distributing this fake Botox. They're approaching dermatologists, actually. So they're everywhere. They're very easy to find. And so you have a cheap alternative. But what people don't realize is that these are not FDA monitored. So you don't even know what you're getting. So sometimes in these vials, they're intended for cosmetic use, but because they're completely unmonitored and unregulated, they can have very high concentrations of Botox. They can be compromised with heavy metals or bacteria. They can cause infections, allergic reactions, the reaction that I mentioned, the botulism, iatrogenic. So you really don't know what you're getting. And so people want a cheap deal, but it could be at the expense of the health of their customers or their patients.
Yeah, if it sounds too good to be true, it might actually be. There's some pretty scary statistics coming out of this situation right now. In fact, we're learning that medical devices, 37% of them have encountered counterfeits, 37%. 20% patients have experienced adverse events from them, and injectables, 41% of them have encountered counterfeits, and 39% of patients have also experienced adverse events from them, which you mentioned could be kind of scary, even including a little bit of paralysis, maybe affecting your breathing, that sort of thing. So as Dr. Abai mentioned, if you're looking for the real versus the counterfeit Botox packaging, you want to highlight holograms, serial numbers, and label differences. Also look for FDA and CDC safety warnings as well, so that you can, like Dr. Abai said, take a picture of it, take a picture of the box, and then, do your research that way.
Exactly, and the best bet is to go with somebody who is medically trained to do this procedure, such as a board-certified dermatologist or plastic surgeon, or a medical professional who is under their supervision. So these are the individuals who are going to have the highest level of safety and following these regulations, and they're going to be using the products that are traceable, that are FDA approved. So if you are not really sure, then go with a provider that you know is the most qualified to do this procedure.
Are you wary of when you hear Botox parties and they're out of, someone's house in the neighborhood, or, are you a little wary of those?
A lot of these issues with the fake Botox, they're happening in people's homes. So that is another red flag. If the price is super low, it could be too good to be true. It might not be real, and it's really not worth risking your health for these types of procedures. So you have to be careful and protect yourself.
Dr. Abai, thank you so much for joining us from UC Davis Medical Center.